Bed sores are areas where the skin has broken down due to the pressure created on the body. They can go very deep to the bone. Bed sores can cause pain and very serious infections that can lead to death. Bed sores often form over bony areas of our skin where there is little cushion in between the bone and the skin. Most bed sores form on the lower part of the body, including over the tailbone and on the back along the spine, on the buttocks, on the hips, and on the heel. Other common spots are the back of the head, the backs of the ears, the shoulders, elbows, and ankles, and between the knees where the legs rub together. Bed sores can be prevented by proper skin care, a good diet, drinking a lot of fluids, helping patients walk, and by turning and positioning them often. One of your roles is the prevention of bed sores. You should be aware of the causes and complications of bed sore. Let us look at the causes of bed sores and the methods in which you can prevent them. Causes of bed sores. Bed sores can be caused due to multiple reasons in a patient. Some of the common causes and conditions that can lead to bed sores are age. In case of aged patients, the skin becomes dry and the blood supply to the skin is also not sufficient. Such conditions can put the patient at a greater risk of bed sores. Lack of mobility. When a person is confined to a bed or a wheelchair, the blood supply to certain areas under pressure, such as the skin covering the bony prominences, is cut off. This lack of blood supply to the skin will result in a painful pressure sore. Mental, neurological problems. Patients with mental or neurological problems cannot feel the sensation of pressure or pain. This leads to build-up of pressure in certain areas, leading to decreased blood supply. In such cases, you must help the patient in moving from one position to another and relieve the pressure. While making a bed, ensure that the bed is free of wrinkles and the mattress is clean and comfortable for the patient. Friction and shearing of the patient's skin with a sheath can lead to a break in the skin, leading to bed sores. We now know that the most common reason for bed sore is lack of blood supply that leads to break in the skin on the bony prominences. How do we know if a bed sore is formed? When there is excessive pressure on the skin, it turns whitish in color due to lack of blood. Once the skin turns white, it becomes dry and breaks. If care is not taken immediately after the skin is broken, then it leads to the infection of the bone, resulting in a very painful condition. Always look for areas on the patient's skin that may have turned whitish in color. Immediately attend to them and change the position of the patient to relieve the pressure on that area. Prevention of bed sores. One of the most common methods of preventing bed sores is by using backrests and position padding. In some conditions where the patient is unconscious, you have to ensure that pressure is relieved on certain areas of the patient's body. You can use pillows to relieve pressure on the back of the patients who are in a supine position for a long time. Place pillows under the upper and lower back of the patient to ensure that the pressure is equally distributed. Position padding is a technique of placing adequate support to specific areas of the body depending on the position of the patient. Place foam supports such as small cushions to support the head, neck and shin areas. General precautions to prevent bed sores. You can prevent bed sores by providing skin care. Use mild soap and gentle strokes with a soft washcloth when giving a bath to a resident or patient. Rinse the skin well and then pat it dry with a soft towel. Use a bland lotion to lubricate dry skin. Lotion helps to keep the skin healthy and soft. Do not use alcohol or alcohol-based lotions on skin. Alcohol dries the skin. Look at areas where skin touches skin. If these areas are moist, then place some powder to help keep the area dry. Do not let the patient remain wet or dirty with urine, feces, or other fluids, including water or tea. Wash, rinse, and dry all wet and dirty skin. For patients who stay in bed, the chair or the wheelchair, move and reposition them at least every 2 hours. Keep a time track sheet to monitor the number of times you have changed the position of the patient.